What is spondylolisthesis? The spine consists of vertebra. These are bones that are stacked atop of another in a straight or neutral alignment from the front, and they have normal curves from the side. And each adjacent vertebra is separated by an intervertebral disc that provides spacing and cushioning and prevent friction from bone on bone. It also helps support the structure and facilitate flexible movement of the spine and acts as like spine shock absorbers. So the spinal vertebral discs have many different functions. And in the spine, we know there's three main sections of the spine: the cervical spine, which is the neck, the thoracic spine, which is the middle back, and the lumbar spine, which is the low back. A spondylolisthesis is a condition of spinal instability, most commonly associated in the lower part of the spine. And while the design of the spine is based upon movement, that if a vertebra can move too much, it can shift out of position. And normally what happens in a spondylolisthesis is that the bone has moved forward relative to the bone below. And this forward movement can cause some problems to the spinal cord and nerve system and muscles around that area, and can cause pinching. And this pinching can encroach on the space that the spinal cord and nerves can lead to, and can lead to spinal cord tension or nerve tension. Now, spondylolisthesis can have many different causes, and simply to state is that it has a 6-point classification system. And to summarize this is that spondylolisthesis can be caused by either a birth defect, vertebral fractures, or maybe there's actually a fracture within the spine, a defective pars, and that's like a part of the bone that can have a small defect in that part of the vertebra. It can lead to spinal degeneration, which normally can happen as a result of overuse, strain, age, spinal tumors, or even spinal surgery. So you can see there's many different classifications associated with spondylolisthesis. One of the most common associated symptoms with spondylolisthesis is definitely pain. It can be associated with it, but the symptoms can vary, and they're normally they're determined by many different variables, but the most common one is age, severity, and the actual underlying cause. The most common symptom, like I mentioned, is back pain, and it can be like a stiff back, it can be tight leg muscles, but it can lead to more nerve pain, like sciatic nerve pain, or pain going down into the leg if it's in the low back. But typical spondylolisthesis are typically associated there. However, a bone can move forward in the neck as well, which can start affecting neck nerves. And in addition, once there's a spondylolisthesis, it can start leading to unnatural spinal curvatures, not only from the front, but from the side. Now, spondylolisthesis can have many different treatments that can be associated with it, and the treatment plans are typically customized around the patient's age and, of course, condition and severity, and, of course, the symptoms that they're experiencing. And we know chiropractic care can help in working towards adjusting the position of the shifted vertebra back into a more normal alignment with the rest of the spine. Adjustments can also help take pressure off the vertebra below and help the surrounding nerves and area. This can also improve disc health and function because it increases circulation to the area, and this can be done through physical therapy and exercises and rehabilitation. And lastly, that there can even be braces that can be used to help support the spine while it's realigned, while it's being realigned, to help stabilize itself. Now, like I mentioned, that there is a connection between spondylolisthesis and scoliosis. And because spondylolisthesis is a condition of spinal instability, that we know once the vertebral bodies start to shift out of alignment with the rest of the spine, the spine can start to shift further out of alignment to start developing a scoliotic curvature. Scoliosis, like I mentioned, is a development of an unnatural spinal curvature from the front that also rotates. And this scoliosis is a progressive problem. So typically, as the scoliosis worsens, the spondylolisthesis worsens, and these two things can kind of feed themselves. And we know there's a direct increased incidence of patients that have scoliosis with patients that actually have spondylolisthesis, and this is very well documented. So one thing can lead to the other, so therefore treating the structure associated with both conditions is very important. Now, we know spinal instability can lead to a number of issues, and one thing that can help develop is something called scoliosis. And spondylolisthesis patients also have many causes, and therefore we must address the entire structure of the spine, not only the curvatures from the front, but the alignment from the side to help get the spine into its best alignment. And normally using therapeutic approaches in a conservative manner that combines many different therapies can lead to a positive prognosis for a patient with spondylolisthesis and scoliosis. However, untreated, we know both these conditions have in its very nature to worsen over time. So we recommend early treatment if you know that you have these things, even before they start initiating significant pain and discomfort, to have the best prognosis long term. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.